Greetings, everyone. This is Dr. William Richardson from the American Clinics for Preventive Medicine, acpm.net. And today I want to talk to you about a subject that is very, very important to all of us. It is detoxification. And we're talking about detoxification with food, detoxification with herbals, and we're going to get into that right now. So detoxification mainly for us has to do with our GI tract because we breathe out toxins and we urinate out toxins. But many times, many of us have constipation, or we're not regular with our bowel movements, or they're small, like little rabbit pellets instead of very long and fibrous. So the first thing you have to know is that there are cleansing diets, and the most cleansing diet is mostly a raw food plant-based diet because it has fiber. Fiber should be in every bite of food, and that's naturally going to cause a detoxification, a natural cleansing, so to speak. So how much fiber? We're talking about enough fiber to fill 2 buckets per day, and then you're going to have great bowel movements. Now, there are also herbals that are used regularly to keep people detoxifying and having bowel movements. So we're talking about bulk-forming herbs. Bulk-forming herbs like psyllium, halls actually act as a broom to clean the GI tract out. And then you have stimulatory laxatives like cascara sagrada and senna, which when you take those, the body wants to reject them out of the body, and it causes increased movement via peristalsis, which is the natural movement of the bowel. So if you overdo those herbs, you'll get little black spots in your colon, and that's called melanosis coli. Melanosis coli. So what we're talking about is using these herbs in a more judicious and occasional way. You don't want to use those every day. That's when you run into problems. If you're going to use them intermittently. And then, guess what? You're going to have to replenish the beneficial bacteria depending on how much cleansing you actually go through. So we're talking about probiotics orally for a month, the beneficial bacteria. Then you have prebiotics, and prebiotics are actually inulin and soft fiber that you get from eating apples, oatmeal, and things like that. That has pectin as an example. Inulin are examples of prebiotics, and what prebiotics are food for the beneficial bacteria or the probiotics. So they work hand in hand. Then the other type of fiber, the insoluble fiber, is good as a brush for the GI tract, and that goes to eating plenty of whole raw food. For instance, apple juice is certainly not as cleansing as eating apples because you're missing the fiber. And so juicing has its place, but eating whole food is the most important thing you can do in the form of blends, salads, and you can cook it. You will decrease some of the cleansing effect if you do. So make sure you eat about an 85% raw diet at least, if not toward 100%. So there's a lot more we can go over. I'm going to do future videos on cleansing, and so stay tuned. This is Dr. William Richardson of the American Clinics for Preventive Medicine, acpm.net.